Hey, Alli, your 3 weeks post-op on total hip replacement, is there anything you wish you would have known before going into surgery?
Holy moly, yes, Shauna, and we're going to get into that some crazy stuff about my journey and things that you definitely want to know. And before we dive in, I want to give a shout out to Miss Marcia Jennings. Thanks for listening to the Girls Talk Healthy Aging. Now let's dive in.
Welcome to the Girls Talk Healthy Aging podcast, where we dive deep into pressing health and fitness issues facing aging women. I'm Alli Kerr.
And I'm Shauna Kaminsky, and together we'll bring candid conversations, expert advice, and personal stories that will inspire and empower you on your own wellness journey.
Alli, I've been dying to talk to you. We're just past 3 weeks on the total hip replacement post-op. Give us an update. How are you doing?
I've been dying to talk to you as well, Shauna. And as you know, I've had some setbacks that have kept us from getting to have this conversation. I am doing well, and I'm knocking on wood as I say that. And yeah, we'll talk about kind of the things that have transpired. Thankfully, today is a good day. I'm even going to probably be walking a little bit on my walking pad really slowly as I talk to you, very, very slowly and carefully. So that is very good news. I'm just a little over 3 weeks out from surgery, and I'm able to walk without, assistance. I mean, if I'm going somewhere, I may take a cane but I'm able to get around decently well. I'm actually pretty surprised at how well this soon.
Yeah. Yeah, I think that was one of my surprise findings with my hips was like how mobile. And before I left the hospital, had to walk around, I had to do stairs. Was that your experience?
I only got to walk to the bathroom after, and they had a lot of trouble waking me up, and that kind of goes into some of my complications. So yeah, I did not do a lot of mobility after surgery at all. And I was not able to do a lot of mobility after surgery. And so I feel like I'm a little behind where I could be, but I also know that that's kind of par for the course for me. And I am good at playing catch up.
Yeah, and I think, everybody's experience is going to be a bit different. And, you have some special circumstances with Crohn's that complicates things.
Sure, absolutely. That definitely does complicate things. And having just a digestive system that is not normal and healthy. And of course, I had to stop my Crohn's medication because I'm on an immunosuppressant drugs for Crohn's disease. I get infusions every 8 weeks-ish. And so we had to time all that with my surgery. So that was a big deal of like timing the surgery. We had to do it within a window so far out from when I had my last infusion for my Crohn's. And then I'll have to wait before I can do another infusion. And so, yeah.
How long will you have to wait?
I'm not exactly sure. I'll probably find out I will probably talk to the doctor at my next checkup, probably in another 3 weeks. So, yeah, so my window will be a lot bigger than the normal 8 weeks between my Crohn's infusions. And then the other challenge with that is medications, they go through your gut. When you swallow a pill, your gut has to deal with that. And because of that, that is a challenge when you have Crohn's, and when you have surgery, they want you to take aspirin to keep you from having blood clots. Well, aspirin is not so friendly on the Crohn's gut, and so that can increase bleeding and cause problems there. And so it's been this balancing act with that going on, and hoping that my Crohn's doesn't start flaring up too much, since I have to go longer without my medication. And so I'm being very, very careful about what I eat, because don't want to eat anything that's going to aggravate things. And then, of course, like I said, the medications is another thing that can really have a negative impact on my Crohn's, but also have a negative impact if you have a pulmonary embolism because you have a blood clot. So, the thing with Crohn's is there's this constant weighing of, I've got this and I've got that, and I have to make decisions based on what's going to be the most emergent thing that we need to deal with at the moment.
Yeah, that certainly does complicate things. So, I'm overall though, are you happy that you got the surgery?
I would say right now, yes. And I mean, I feel like I'm, again, like I said, behind in my recovery because of other complications, not just the Crohn's that I've dealt with that have kept me from being mobile. And I think I'm a little late just experiencing like what does mobility feel like? What
Yeah.
so I don't really know how. I think there's still so much left to my story. However, obviously I feel like in the long run I'm going to be much better off, and that is the hope.
Yeah, I would think so as well. And
Mhm.
I think it's good for listeners to hear that, you are prioritizing mobility even while balancing an autoimmune disease. That's what Crohn's is, right? Is
Right.
autoimmune disease. So having an autoimmune disease doesn't necessarily preclude you from, taking care of certain things. Like joint mobility is so important, because tell us a little bit about, like, how was your life impacted by having a hip that was needed replacement?
Yeah, so I've never been one to track my steps. So I don't know how
Mhm.
many steps I get in a day, but I know that it was significantly lower, and it just kept getting lower and lower because I've been dealing with this for 3 years. And so as it progressed, my steps became less and less. And as for my career, I am a trainer, and training clients, I like to be an active trainer. And in the perfect world, I like to have good energy, and I like to be able to demonstrate things, and I like to kind of get in there with the client sometimes. And I have not been able to do that for a long time. I've been really coaching from the sidelines more
Yeah.
than I would like, or more than I enjoy. Basically telling people what to do, maybe showing them some of what to do, but just being limited in what I could physically do. And then I enjoy being able to do all the things activity wise. I want to be able to play pickleball. I haven't been able to play pickleball. I tried once, probably in the last, like me and Robbie went out and kind of dinked a little bit a few months, 2 or 3 months ago, maybe. And before that, we tried to play with another couple once, and I was having horrible pain in my foot because I think it's all connected. But
Yeah.
and so I had to stop. Like at the very end, I was like not even able to finish playing like 3 games. And so, I enjoy being active. I like to do ninja or silks, and so those things are things that I have been able to just do a little bit of, but not really enjoy the way that I would like. And so, yeah, it was really cramping my style.
And how did you see that progressing if you didn't do something?
I don't know if I'd have been able to walk eventually. And I think it
Yeah.
would also have continued to compromise other problems. One of the things that the surgeon did is he actually made my left leg a little longer in surgery because I had an imbalance there. And I've had a leg length discrepancy for a long time, years. And so all that compensation, I would even like my left shoulder was being affected. So it's not just like it was hurting my hip. I've also had a lot of back problems for years and years and years, and I don't know if that's hereditary. My mom's also had a lot of like back, hip stuff. I have a little bit of scoliosis going on. So there's just a lot of things. And so the hip, once it got really aggravated and
Yeah.
painful, was just causing it causes the whole chain. Our body is all connected. And so when one thing is off kilter, it just throws everything off kilter. So I think I would have continued to damage other things had
Yeah.
I continued on the path I was on. And I think my hip, well, I've already started feeling problems in my right hip, some too. I started feeling some of the same symptoms. So I think my right hip was also being affected
Yeah.
by just the compensation. So yeah, waiting, it can seem like a good idea. Like I'm going to try this shot, and I'm going to do this, and I'm going to do that. But it also, especially as things just continue to deteriorate, you're not really doing yourself any favors. And I was not doing myself any favors.
Yeah, and your world gets smaller, and you might you notice, because you're a physical person, live a physical lifestyle, but but others might not even notice that, oh, I've turned down these opportunities because my knee, my hip, my foot, whatever the pain is.
Oh, yeah.
It's just that, oh, I don't know if I can go that long or that far. And so there's a lot of missed opportunity that you might not even discount at first, but over time, and you're young, but like I'm 13 years older than you. But like over time, when you stop doing things, these are the things that you cannot do.
Yeah.
And I mean, whether you're 50 or 60, that's our kind of difference. It's going to be the same thing.
So, and muscle loss. I was definitely losing muscle, especially in the hips.
Absolutely.
Certain areas of my leg, thighs were just not working. They were compensating, but not doing their normal function.
Absolutely. And let's go back a bit, because you had another big obstacle in your way to this surgery. Tell us a little bit about this frustration, because we had talked, I think it was the day before, or maybe it was just 2 days before your surgery. And I was just gobsmacked that you were still waiting for this last piece of the puzzle. Tell us about that.
Yes. So you know that I have been to 3 orthopedic surgeons throughout this 3-year period, been to a physical therapist, had 2 cortisone shots, one in the joint, one not in the joint. I've had 2 MRIs with contrast, without contrast, had x-rays, and I was on a steroid pack initially. So those are in addition to like taking Tylenol or ibuprofen. So I'd done all these things. However, my insurance company decided that I have not done enough, or that they didn't have enough documentation of all the things that I have done to justify, nor the fact that my doctor said the only thing that's going to fix this is a hip replacement. And the insurance did not take that as enough. And so we were waiting for approval up until the day before my surgery. And as you may remember from your surgery, when surgery's coming, like you have to get mentally prepared, you have to get emotionally prepared, you got to get
your work ready.
I had to have things ready at work, and I'm sitting here in this like limbo place. I have run a business, and I got people that are counting on me, and I need to make sure things are covered. And here I don't know if they're going to approve my surgery or not. And so, we are down to, sorry, I dropped my earbud fell out of my ear. We are down to literally hours before the surgery, and the insurance company denies it. And they said I need to take, need to show them that I tried Tylenol and ibuprofen, and that I tried physical therapy, and that basically those are kind of the main things that they were wanting. And so the doctors are, going back and forth trying to give them what they're wanting. And anyway, my surgery is hours away. And so Robbie and I talked about it, and I just messaged my surgeon and I said, how much is it to pay cash? And so we got the number. Robbie and I talked about it, and we're like, nope, we're doing it. Screw them, basically. We'll deal with them later, but right now we got to get this done. Like it has affected my everything, my business, my personal life, my ability to move. My pain is just, crazy, high level of pain, and I'm just miserable, and I'm geared up. I have a doctor that I like, that is ready, that has me on the schedule. And so that's what we did. So we just went ahead and took our credit card to the surgery. And now, we will continue to see what happens with the insurance, but we just decided that my health is more important than the insurances. They are not going to get to make this decision. And that's why I had the surgery. And I had Audrey at work, who I was talking to the day before, and she was like, it's going to be okay. We got it covered. And so that really gave me the freedom to go ahead and do it too, knowing that, okay, we can do this.
Well, I know when we talked and you were on the fence and I was just pulling for you to like, please get it done, Alli. You probably felt my bias, but I said, I know you're going to make the right decision for you. And then I was so relieved when you said, hey, we're going to go through with it. I know that you could have rebooked it a month from now, but I think my words to you were, Alli, a month from now, this surgery will be behind you and you will be up and walking.
Right. I would still be, I still wouldn't even be, who knows when, who knows how long it would take. Yeah.
Correct. And, I think I said to you, if you have any money for a rainy day, it's raining. And
you did.
Yeah.
Shauna's like, it's raining. I was like, okay, Shauna. Okay.
Well, and
So Shauna is going to contribute to the Alli rainy day
fund.
Hey,
I paid my dues twice.
I know you've already done your rainy day fund twice.
Yes, my rainy day fund is like, please, no more joints can go, because for me, it was raining, and like I had to walk the walk too, because for me it would have been 3 to 5 years to wait, and I know that we are in an entitled and privileged position.
Absolutely.
That we could pay out of
I feel
pocket.
very fortunate that I was in a position that I could tell the insurance that I'll deal with you later, but I'm getting this done. Yeah.
Yeah. And I mean, I hope that you get coverage, because if you have insurance, it should be
it would be nice if they actually gave you health insurance when you pay them for it. That would be wonderful.
And in Canada,
they also wanted me, just because this maybe some other people experience it, they also wanted me to go to one of their doctors. And here's the other thing that my health is, I'm a physical person. I'm not just going to put my hip in anybody's hands.
Yeah.
And so I had done research and found this doctor, liked this doctor. This doctor didn't gaslight me. He didn't tell me I needed to go sit down and knit.
Yes, stop moving.
He understood I want to be able to do aerial acrobatics. He understood the assignment and was, supportive. And I was not, what the insurance does is they contract with certain doctors in each state. This particular, and basically they have kind of a deal with these doctors that will send you all the patients in this region if you do it for this price. And so they were also sending me, amongst all this waiting for approval, sending me this information that I needed to contact them about this, how wonderful of this program that they have for us to get this great care with some certain doctors. And so that was also part of that challenge. And so,
Yeah. And so I'm so happy that you took this into your own hands, and worst case scenario, you've paid for it. That was my worst case. Right. And that was like, it was a lot of money. It was over $50,000. Yeah. And
because you got 2 hips. Shauna got 2 hips, y'all, not me. I've only done one so far.
So. Yeah. So, maybe $50,000 isn't a lot for some people, but for me, that's a lot of money.
That's a lot. And for some people, that's not even possible. And
correct. So, yes. So I'm so fortunate that, I had that rainy day fund. But the way I looked at it, and I think that maybe this helps people when you think of it this way, is it's less than the cost of a new car.
Yeah, and this is our body that we drive, we walk around. This gets us from A to Z. Yeah.
Yes.
I do think it is a different way of thinking, and I know that you and I are in this boat. Like, we really value our bodies and our body's ability to do the things and our health. Yeah. And I don't want to say that I would, because some people do have the funds to do something like that. And unfortunately, we just continue to live in misery and pain and limitation. Yep. And taking control as women, sometimes if you can, I'm glad I did that. I'm glad we made the decision that we did.
Yeah.
Even though I've had some, like I said, some complications post-surgery.
And I also, you said I'm behind. You're running your own race here, girl.
True story.
It
really is, yeah. Yeah.
It is the killer of joy, the comparison, right?
Yeah.
And so when you compare yourself to me, for example, a couple things. Number one, I went in right away. You went in as soon as you could. I don't have an autoimmune disease, and especially for hip number 2, I went in as soon as like my pain on a pain level of 1 to 10 was at a 2. I knew the ending to that story, and I knew that if I went in as strong as possible, that my recovery would be faster. So I also want to point out and ask you, you're just turning 50 this year. And was that a big point of contention that you're too young, it's not going to last, maybe you should wait?
Well, that's one of the things I liked about this doctor is that was never a thing with this doctor. He was like, the only thing that's going to fix your hip is a hip replacement. And so I really appreciated that. Like I said, that he heard me and he didn't tell me, well, you need to be less active and go sit down and knit. And, none of that. Because I've heard stories like that. And so that was not a thing with him. And I think a lot of people's reaction when they hear that I've had hip replacement at 49 might be like, whoa, that's really young. But one of the things I think that we don't realize, there's people a lot younger than me that have had hip replacement surgery. I'm by no means the youngest. No, it's not common. It's not as common. However, there are people that also have structural issues, joint issues, back issues, hip issues that can be from childhood or from birth, or they've had something happen along the way that has really caused a problem. And that was a decision. I don't know how long this hip is going to last. I just had to decide, but I know how I was not functioning with the hip that I had. And so it was a thing of, hey, even if I do get a few years out of this hip, that's a few good years versus me going downhill. Because I continue. One of the things I know that you and I noticed, because we have been body conscious and in the health and fitness space, is I notice when my body's changing, when my muscles are getting weaker and I'm just becoming softer and less strong. Like I noticed that. And that was just going to continue. And I didn't like how my body was functioning or not functioning. I didn't like how my body was changing because I was not able to function at my normal level. And going into my 50th birthday coming up, I didn't want to spend 50. I wanted to spend 50 like living life. That was a kind of a motivator in the sense that I wanted to get it done before I turned 50 because I didn't want this to be 50. I didn't want that to be 50 for me.
That's good. My own family doctor for my first hip, he said, well, you're pretty young. I was 58. And he said, maybe you should wait. And I said, wait for what? And medical technology is going so quickly. The hip replacements today are much better than they were 10 years ago. So in 10, 20, 30 years, if either of us need a new one, there's going to be new technology. And my surgeon, I had the same surgeon. I paid privately. I had to go out of province. I had to fly to, 5-hour flight to and from 4 days after surgery, which sounds terrible, but it was fine. I asked him about what will I be able to do? Like I enjoy Olympic weightlifting. And he said, this hip will outlast my career as an orthopedic surgeon. It will last 20, 30 years plus. And, I was very clear that I'm going to be doing, lifting body weight over my head. He said, you're fine. So,
yeah. I think finding a surgeon that will listen to you and that understands what your goals are is super important.
Yes. And again, we are very fortunate that we have this. So I don't want to come off as just being such privileged princesses. We were very fortunate.
Absolutely. Absolutely.
But
and even if you don't have that ability, just really pushing through the system of the insurance, whether you're in Canada or whether you're in
yes,
the US or wherever you are, just being that squeaky wheel. And
that's what I was going to say, is that being persistent. And if I wasn't allowed to go privately, then I would have been the one calling on weekly, so that maybe somebody would just get me in and done to get me off their back. but it is the squeaky wheel, and that's the thing, is that you do have to be an advocate for your own health. So tell us now, what's ahead. We're at 3 weeks. I know for myself, there was specific guidelines, like I couldn't do hip flexion with any weight of any sort, until after 4 weeks. Like, you could sit down and that sort of thing, but there are specific physio exercises that I probably push the envelope on a little bit more than normal. Are you kind of in that groove now that you're doing the physio? What does your life look like right now?
Yeah, and I want to back up just a little bit, because this ties into this, and talk about another setback that I had, and that was because I am behind, I would say, in the physio stuff, and when I went to my last appointment, we did not even discuss that because there was a more emergent situation. And when I went for my last appointment, one of the other complications I've had since surgery is I was having a lot of trouble breathing.
Right. Yes.
I was having a lot of
about this.
What'd you say?
Well, of course, we need to talk about this.
Yes. Well, because I want people to know about this, because I did not know that this is common, and I've been to 3 doctors and it didn't click with them. So if there's somebody out there listening, I want them to know about this, so that if they experience this, they can be aware that this is a common thing. So I'm having trouble breathing, and it just is getting worse. And I feel like I just have pressure on my chest. I feel like I can't take deep breaths. And so when I went to my 14-day out appointment, so I went to get my staples out of my incision, and I told the physician's assistant about my breathing issues. And I think the first thing that they're worried about, well, it was obvious that they were worried about that I might be having a PE, a pulmonary embolism, which is like a blood clot in your lungs. And so that can be obviously a life-threatening situation. And so he encouraged me to go to the emergency room that day. And my surgeon is in Valdosta. And so I went to the ER in Valdosta, which is a couple of hours away. I didn't have to drive as far as you, Sean, or do a plane ride. But a 2-ish hour car ride. So I went to the ER, and they checked. They did chest X-ray. They did a CT scan. They said my lower lungs had density in them. They gave me a breathing treatment, and then they that seemed to, my breathing seemed to get a little bit better. They ruled out the pulmonary embolism from the CT scan, chest X-ray. They didn't see anything there. They didn't see any pneumonia there at this point. So they diagnosed me with bronchitis and acute asthma, and sent me home with a nebulizer, which is like a breathing machine with medication. And now, we talked earlier about my gut having to handle medicine. I got sent home with 5 medications on top of, what I was already taking for the surgery. And Shauna knows how fun it is for my body to deal with medications from being in Peru with me, and my sometimes things just don't reach.
Yeah.
And so there's that whole seesaw again. I'm now taking medications, but I'm also doing breathing treatments, and I'm not getting better. It's not helping really. And I'm one of those people, even when 18 months ago, I was in the hospital with pneumonia, and my O2 levels were reading normal, even though I could not breathe. And thankfully, the ER doctor back then, when I had pneumonia, he knows me, and he knew that I was not normal. And so he did not just look at what my stats were saying, and he decided to do an arterial blood gas. test, and they found that it was only at 50%, which is not good, not good at all. So I was in, I got a nice week-long stay in the hospital for that. So I was checking this time around with this issue after surgery. I was checking my O2, and once again, it was reading in normal ranges. But I knew I am not right. This is not cool. I was really worried that I was getting pneumonia again. So long story short, wasn't helping. I followed up with so I went to the follow-up appointment with physician's assistant at my hip doctor. They sent me to the ER. They thought maybe PE, pulmonary embolism. They sent me to the ER. They checked for that. I was fine with that. No issue there. They said bronchitis, acute asthma, and they were worried, they didn't want it to turn into pneumonia. So they put me on an antibiotic, a steroid, cough medicine, decongestant, and the asthma medicine, nebulizer. Was not getting better. Went to see my doctor, and my doctor's, I was basically finishing up the ER meds. And so my doctor was like, stop the meds and let's just see what happens. And among this time, I remembered that I had this, it's called an incentive spirometer. And when I had been in the hospital 18 months ago with pneumonia, I had this device that I would use to basically help open up my lungs. And so I pulled it out and I was like, let me just try this thing. And lo and behold, after the first time I used that thing, I started breathing better. I'm like, what is this? What the heck? And so, I started using a little bit more. And in between that time, I went to my doctor. She said, stop the meds, because I was like, I don't know that they're helping me. And so Robbie was talking to a coworker and telling her about my breathing problems. And she said, I have this issue. Anytime that I get anesthesia, they always tend to give me too much. And I end up having breathing problems, and I have to use an incentive spirometer, and that's the only thing that helps. And so I started using that more, and I've gotten better. This was earlier this week, was when I went to my regular doctor. So this is just in the last few days. I'm actually able to carry on this conversation with you, which earlier this week I could not have done. So that's how much difference it has made in just a few days. And so I reached back out to my surgeon and I said, I'm pretty sure I know why I was not getting better with the ER meds. I had, and let me see if I can say this right, atelectasis. And basically it's a partial or full collapse of the air sacs in the lungs, and it's extremely common after surgery.
Wow.
Extremely common, but yet nobody thought about that could be, because I think they were obviously thinking about the most emergent things, like, yes, let's make sure she's not having a pulmonary embolism.
Yeah. Fair. Yeah.
So, totally fair. And the fix for that is using the incentive spirometer and opening those air sacs back up. And that has been game changer for me. So atelectasis, I think is how you say it. So it's ATELECTASIS. If anybody wants to look it up. So
you'll put it in the show notes.
Yeah, so I just wanted, because that is, and this gal that Robbie works with, she's like, I don't know why they don't give everybody that has any kind of major surgery a incentive spirometer. It's just this cheap little breathing toy, little plastic thing that is amazing, because this is such a common thing. Wow. And I'm guessing a lot of people get misdiagnosed. And here's the thing, had I not figured it out and I just kept doing these treatments that weren't helping, it can turn into pneumonia if you don't get the right treatment. And so, and it still could. I mean, knock on wood, like I said, right now I'm doing a lot better. So I do want people to know about that. I did want to.
Yeah, that's so valuable. That's such valuable information.
Yeah.
So
because it is common, and it's probably even more common because a lot of times it probably gets misdiagnosed. So my guess is it's more common than what is reported because it gets misdiagnosed. And it can turn into a bigger deal and last for a long time. You could have bronchitis and that could turn into pneumonia. And this could be months of, issues. Chasing things. Yeah. Yeah.
Wow. So your physical recovery of your hip has been put on the back burner because breathing. Who knew? How
And
important.
with Crohn's disease, another challenge I have is anemia. So because I've had more bleeding, now I'm also becoming more anemic. And I can tell that because I've been down this road before. And that is another, that also can affect your breathing as well, anemia. So it just makes life more fun when you have something like Crohn's. I started my menstrual cycle the day before surgery, which was wonderful fun. But then my cycle stopped. And then it just started back recently. So I'm losing blood from Crohn's. I've got my menstrual cycle going. So yeah, I'm also dealing with some low iron stuff going on right now. So it's a good hodgepodge. So needless to say, I've been doing a lot more laying around, which is also not good for that breathing situation.
Yeah.
Movement is better, but with the hip and then with the breathing and then with the low iron, I felt like a slug, like legit.
And you know, you're not one that wants to lay around because you're not a lay around person, but when you feel like a bag of soup, you need to rest.
Yeah.
And so that's
I'm just doing I'm doing a little bit of the home. My surgeon did not send me to physical therapy. He gave me exercises to do at home. And when I go back, I'll talk to him as far as maybe what I need to do beyond that now. But now I'm moving more because I can breathe better. And I am doing those exercises that I can do basically seated or laying down in addition to.
Well, the first ones, that's all they are, is seated and laying down ones. But now you can
between your legs, squeeze your booty, and let's see, straighten your legs.
Yeah, a leg extension.
Your ankles, drag your heel when you're seated so you can engage your hamstring. That's really it. So those are the exercises now.
Yeah, but they're so important.
And I'm going up and down stairs, I make a point to do that.
Yeah.
Yeah.
You can't run before you can walk. So those are important to get those muscles firing, get those nerves back. How has your pain been for the hip?
I mean, I can tell people, the hip has been the
least of your
part
worries.
Of this. It's been the easiest part. Knock on wood, so far, my hip has not given me near the grief that all these other issues have given me.
Well, I think that if we can get you breathing, an important part, don't stop that, Alli. If we can, once your breathing is, and then once you can get back into your Crohn's medication, it's going to be a snowball in a positive direction. And your hip, I don't want to say it's an easy recovery, but because it's a muscle sparing, you got the anterior approach, which both of us would highly recommend if you had the choice, if you have that option, because it's muscle sparing. You do have to learn how to walk again. The kinesthetic awareness is very different.
And I have one leg longer than the other. He said that's going to feel weird for at least 3 months. I'll be walking, kind of feeling like I'm walking wobbly, weird off. But
that's how everybody feels after a joint replacement, because your body feels different in space, but you can handle that. You can do that. You can relearn that. That is going to be the fun part of recovery as you continue to be able to do more.
Yeah.
So I'm here to encourage you to say, hey, it'll come once
a girl that I was talking to on Facebook, Mary Beth Snell, is the sweetest, most amazing gal, and she reached out and she's telling me her husband had hip surgery, and he was, I think, younger than me when he had it, and he it's been 6 years ago, but he had complications. He had an infection. They had to go back in and replace parts. But she said he's so glad that he did it, because now they can go and do things that they couldn't do before. And so hopefully this will be a blip on these things in the scheme of things. This will be such a blip on the radar.
Correct.
Such an improved life.
Correct. And I look back on my recovery, and when you're in the thick of it, it seems like forever. But now, I can talk from hindsight, and looking back, I can say, Alli, it was just a blip. Given all the things that I can do now, and I have no question in my mind that you will be able to do all the things that you want to do in pain-free, it just, yours might take a little bit of time, but like I said, you're running your own race. No one should compare themselves to anybody else. Everyone is a unique and perfect snowflake that has to take the time that it takes. So we're wishing you all the best. That's my wish for our for you, not just, and I know I'm with our listeners when we're wishing you all the best for continued good health and smooth sailing on the recovery. Do you have a wish for our listeners, Alli?
My wish is just keep it all in perspective and know that it is a journey, and there might be some hiccups along the way, but I still would recommend that people take care of your body. We only get this one. And so if there's something that's not working, get it fixed.
Thanks for listening. You'll find me, Alli, on Instagram at Alli Curve Fitness.
And you'll find me, Shauna, on Instagram at Shauna Kaminsky. Feel free to pop us a DM with questions and or feedback. If you're enjoying the Girls Talk Healthy Aging podcast, please subscribe and share it with other health-minded women. Ratings and reviews are also much appreciated and help us get our message out to a larger audience.
Until next time, be healthy and be happy.